Welcome to the No More Drain Pain step-by-step video tutorial for peritoneal dialysis patients. In this video, we're going to discuss a method of preparing for a normal treatment session that has helped us reduce and often eliminate drain pain. It is important to note, as a disclaimer, that we are not medical professionals. We are just normal people learning how to use the peritoneal dialysis machine, and we came up with solutions that are perfectly fine for our patient and our treatment methods. Be sure to consult with your doctor, your physician, and your local medical professionals that can help with your particular situation. This may not be perfect for your dialysis treatments, but it has worked for us. It's important to note that our main method of reducing drain pain is to actually initiate a manual treatment setup with the patient in order to provide some level of fluids for the Baxter machine to pull on when they start their nightly treatment. It's important to note that our patient does not go on the Baxter equipment without some level of fluids within their peritoneum. This often results in a pull, a sharp pain, and a dragging sensation, suction sensation, from the lower stomach lining. By initiating a manual pre-fill with a small amount of dialysis solution, we are able to reduce that level of pain. In this scene, you will see how we release the solution in the manual treatment by breaking the frangible seal and unlocking the clamp, which allows the liquids to flow freely. It is very important to use a high-level disinfectant with catheters, caps, connectors, and you can never go wrong with some extra Germ-X or hand sanitizer as you handle the equipment. What we normally do is release the cap on the connector device before opening the catheter. And we try to do this simultaneously in one fluid motion. And now we are ready for our pre-fill manual treatment. Breaking the seal again allows the solution to flow into the patient's catheter. This is for those of you who are wondering, how difficult will it be to do my first treatment? What equipment do I need? How long will it take? In these next few scenes, we hope to show and share our techniques and our tips and tricks that have helped us do this successfully every night that we need a treatment. Continue to follow the guidance on the screen. We will skip forward a little bit in order to save time in this video. We'll enter the patient's weight, blood pressure, and other information the screen is requesting. Some of these items we can skip, and some of them will apply to different patients. Now we're ready to start our treatment. To prepare for the treatment, we need to set up all of our equipment all of our supplies and all of our resources. One of the best features of the Baxter dialysis equipment is that it's simple and easy to use and has lots of tools and areas where you can set up your equipment so that it is protected, clean, and not in the way while you are doing your treatment. So now we're going to clamp all solution lines except for the patient's line. This is to control the flow of fluids and solutions at the proper times. You should hear a clicking sound, which confirms that you have clamped these correctly. In this scene, we'll show you how to insert the cassette properly by placing the cassette in the front door and putting the left and right lines into their proper holding areas. The next step is to unfold the heater bag and place it in the heater tray. You'll also secure the tubing in the guide post so that the tubing does not become twisted. Now that everything is in place, we will close the front door, making sure not to pinch any lines in the process. And now we will close the heater lid. Oh, make sure you don't close it on the tubes. The next step is to take the patient line from the organizer on the right side of the Baxter and place it in the patient line holder on the left side of the Baxter. Be sure to place it securely and firmly to avoid error notifications or any problems. Now we will follow a series of steps that help prepare the lines for our treatment cycle. We will close the white clamp on the patient line and remove the blue cap from the drain line and place the end in an open drain area. One of our favorite shortcuts for collecting drainage through the drain line without too much hassle is to go to your local hardware store, a Walmart, wherever you can find a large industrial-sized bucket. Then we cut a small hole just big enough for the tubes to fit in, and we allow the fluids to drain into this instead of into our bathroom area or a water runoff area. Any type of drain needs a place to go, so this bucket has proven to be one of our favorite tools for collecting, moving the liquids, and staying sanitary at the same time. Now we're going to move on into connecting the PD solutions. Prior to connecting our PD solution bags, the Baxter will run a cassette test, which could take up to 4 minutes or longer, depending on your equipment. Be sure to sanitize and disinfect your area, your hands, wear a mask as it's shown on the screen, before you go on and move into connecting clamp lines to your solution bags. Every patient has a different level of solution requirements, so be sure to check with your doctor prior to initiating your first treatment. These are just the solutions that we use for our current level. When connecting the solution bags to the connection lines, it is a one fluid motion, often like connecting for the manual treatments. At this point, we have not broken the seals yet. We're just connecting the lines and making sure not to contaminate the ends of each line. Once we have connected all the lines to our solution bags, we will break the frangible seals on each connected solution bag line. Then we will unclamp the lines in a particular order in order to allow the liquids to flow freely. Now we will prime the Baxter for treatment. Now that we've completed our manual pre-fill and set up our Baxter equipment, we will prepare the patient for the traditional treatment process. The manual pre-fill usually for us has taken about 15 to 30 minutes, and the patient usually receives 500 to 1,000 milligrams of dialysis solution to prepare for their initial drainage treatment. You want to disconnect the manual pre-fill after the 15 to 30 minutes or once you've received the amount of solution that works for you. In order to disconnect correctly, you want to do this in a clean and sanitary environment and do it in one fluid motion. When disconnecting the patient from the manual pre-fill, it's important to clamp the lines to prevent liquids from flowing while disconnecting. When you begin to disconnect, be sure to use gauze and a swift turning motion in order to pull the lines and replace them with a clean iodine-filled cap. Now that the patient has completed a successful manual pre-fill, it is time to connect the patient to the Baxter equipment. Be sure to put on a mask, disinfect your hands, and keep any and all pets away from the area in order to maintain a sanitary environment. During the initial drain, your Baxter screen may look like this, as you see some level of peritoneal volume flowing from the patient into the drainage bucket. As you can see, there are several milliliters flowing from the patient because we did the manual pre-fill earlier. This has greatly helped reduce our drain pain and the initial suction pain that comes with having a dry stomach or an empty drain. As you can see, the fluids are flowing from the Baxter and into the drain bucket. This has greatly helped us with our cleanup and the overall experience, making it a much more enjoyable treatment. Sometimes you may run into an alert for unexpected volume. In this situation, we just hit end drain for the initial drain, and we hit yes, and we prepare to move on to the night cycle phase. Now that the night cycle phase is started, the patient will continue with the treatment throughout the night, and we are so glad you watched this video. Thank you for watching. Thank you for subscribing. Please share to help other dialysis patients.